Treatment option for indigestion could already be in your spice rack. That's according to a new study out of Bangkok. In fact, researchers say it could be just as effective as the common over-the-counter medicine to treat any kind of stomach acids that are giving you problems. We're joined this morning by Dr. Reena Mehta with Uptown Allergy and Asthma to explain why turmeric could be just as effective as some of these medication options. Good morning. Thanks for being with us.
Good morning. Thank you so much for having me.
So tell us what this study found. And you said it was a small group that was studied, but what did it find?
Exactly. So it was a study out of Thailand where they looked at 151 adults with upset stomach, recurrent indigestion. And what they did was they had some of the patients take turmeric alone, some of the patients take Omeprazole, which is our common Nexium over-the-counter medication, and then some of them take a combination of turmeric plus the Omeprazole. And what they found was that those patients who were taking the turmeric actually had better symptomatic free days from their indigestion. They actually did better than those that were just on the PPI alone.
And that's really good news. Again, it was a small group studied, but for people who have recurring indigestion issues, who we were talking about, who may also have other medications, other medical issues that they can't take medication, having a natural option, this could be a game changer for a lot of people, right?
Exactly. So turmeric, we also call it as curcumin. That's the other name for it. And it's known to have antioxidant properties. You know, there's been lots of studies that shows its anti-inflammatory effects. And the way that it works in the GI tract is that it stimulates the gallbladder to release bile, which then helps with digestion of fats. And so if you're digesting your fats better, then theoretically you're not having as much stomach aches, as much indigestion. And so, of course, medications like PPIs, Omeprazole, things like that are helpful, but of course those can have side effects long term. So having a complementary approach, having an alternative, such as something natural like turmeric, could be a really good option.
And you were telling me there are lots of different ways to take it, capsule form, and what were some of the other forms that people may not be aware of that kind of sound like, that doesn't sound too bad.
Yeah, so you could cook with curcumin or turmeric, so it's in a lot of stews, spices, Indian foods, curries. You can also make something called golden milk. So golden milk is taking milk, adding turmeric, adding black pepper, because black pepper actually enhances the absorption of turmeric, and then putting some honey in it.
And have you had that before?
I have had it. So I'm Indian, and so we do a lot of turmeric. We do a lot of milk with turmeric in it, and my mom would always give it to me when we were sick with a cold, and she would claim that it would make us feel better, and it probably did.
That's interesting. And it tastes pretty good?
Tastes pretty good. It tastes pretty good. And then if you wanted to get high amounts of turmeric, you can always take like a capsule form of it. But of course, you know, if you're taking higher amounts, you should always talk to your doctor. I'm not suggesting just stop your medication for acid reflux, cold and turkey, and go straight to turmeric. Talk to your doctor, talk about other options. But, you know, this may be a natural way to add something else in that may help your symptoms even more than just, you know, over-the-counter medications.
And pregnant patients who can't necessarily take medication, but they have acid reflux, heartburn. This is maybe something that they can discuss with their doctor as an option too, right?
Absolutely. It's pretty safe and it's pretty easy to find in lots of different foods and different ways to make it.
Pretty cool. Golden milk.
Golden milk. Mix it with black pepper.
I'm going to try that out. That actually sounds pretty good. But the milk part is what's going to get me, but I'll figure it out.
You can do almond milk.
There we go. All right, Dr. Mehta, as always, we appreciate your time.
Thank you so much for having me.